Welcome to HCA Talks Health. I'm Zena Le Roux, your host, and with me today is Claudia Slattery. So Claudia is a fertility specialist and a menstrual cycle analyst, and she's qualified under the Justisse Method, which is an internationally recognized method of fertility awareness. And she has over a decade, I think it's more than that now though, of experiencing helping women through their journey with natural birth, control, infertility, menstrual cycle problems, and also family planning. So she's got a master's in sports psychology and an honors in psychology. And as far as I know, you're also an avid cyclist, right, Claudia? Or not anymore? Are you?
No, still cycling is a very big part of my life.
Fantastic. So welcome. It's an honor to have you on the show.
Thank you.
So, Claudia, I think let's start out with you maybe telling us a little bit more about exactly what it is that you do, because it's quite a niche area, it seems, that you do support people with. So just tell us more about how you support women.
Zena, I try to teach women how beautiful their bodies are. We have fought many years through this feminist movement, but through the fight for our rights and fight to just get heard, we've also lost that intuition and that divine guidance that we have been beautifully given, and that is our menstrual cycle, because our menstrual cycle talks to us. And times have changed, and women are seeing their period and their menstrual bleeders differently to what they did many years ago. But as well, we also want to really work in this man's world, if I can say, and be recognized on the same kind of levels. But I do believe that we have such an advantage if we listen. And I have seen it not only in my sport career, I have seen it in my business career. I've seen it as I transitioned to motherhood, that if we have this connection to our body, how empowered we are about ourselves.
Oh, I love that. Yes. So you're saying that the menstrual cycle is almost like a gift, right? And I don't think many women would see it in that way. But tell me more about why you say that, and how we could work with the menstrual cycle instead of against it.
Okay. So we have different phases in our cycle. We have the energetic, the vibrant, the I want to be out there phase. Okay. Put simply is the follicular phase. If I was going to use medical jargon, I like to teach women and connect women in a way that it makes sense. So I just call it the easy way, called pre-ovulatory. Okay. That is the part of our cycle where, we can do anything. We're superwoman. Whether it's getting up at 4 o'clock in the morning to hit the gym or the bike or the run, whether it's being creative in your day job, or whether it's being a mom who is juggling 25 things at once. But then ovulation comes, and then after ovulation, otherwise known as post-ovulatory phase or the luteal phase, is the time to rest. It's the time to kind of hit the numbers, hit the budgets, hit the boring admin of any job, because we don't have much creativity then. It's the time to change your training, kind of go out for longer rides or longer runs. Be compassionate to your body. Say, okay, well, actually, I don't feel like waking up at 4 o'clock in the morning. I'm going to sleep in, because I need the sleep just as much as I need the training. And there are these very different phases. Now, I'm also very much in the school of thought where if a race comes up or a huge business meeting comes up and we are bleeding on the menstrual cycle, we can't just phone our boss and say, sorry, can we move our big meeting because I'm bleeding? I can't phone Ironman South Africa and say, hi, I'm having a menstrual bleed next week. Can we just change your race? So we have to learn that when we bleed, life carries on, which makes us stronger, believe it or not. And because of that mindset that, well, too bad, so sad, I actually have to carry on, we are stronger. But throughout the roughly 30 days of our cycle, we have the ability to prioritize and focus on different areas of our life. And if we did that in our life, do you know how much more productive we would be? How much more compassionate? And that is the reason that women who have not been on any form of hormonal contraception and who have let their cycles just develop and they have healthy menstrual cycles, what it does is it means that you can actually prevent chronic disease such as high blood pressure, any sort of chronic long-term disease, because you've followed the flow of your body, the fast, 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 and the slow, slow, slow time to rest, just like the seasons. It's not all summer. It's not all beautiful and hot. It's the hot, it's this change from spring, and then it's the cold of winter. Our body and the earth operates in different sorts of seasons, and that's what you need to see your body and your menstrual cycle, the flow of fast, 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 and the time to calm down.
Yeah, so it's all part of that ebb and flow, but just respecting the downtime as well. And I think not often perhaps that goes with women empowerment, you know, where we feel like we need to keep up to a certain standard all the time, you know, and never rest. But it's such an important part of being a woman and a human being, you know. But so you're saying that in the first part, so before ovulation, that's when we can push ourselves. So specifically to training, are you saying like your more high intensity interval type of workouts, you know, and strength training? And then in the second phase, it's your more longer endurance, your body can tolerate that more, right?
Exactly. Because putting the wrong sort of training in at the wrong time of your cycle can actually make you feel awful about yourself and go, well, I can't do this, and then you give up. So I do really believe that it's all about planning your trainings so that you walk out feeling confident and good about yourself, and that you're actually making progress.
And does that have to do with the different hormones? So I know in the first phase it's predominantly estrogen, and the second phase it's progesterone, right? So how does these different hormones impact us in that way?
So estrogen, I say it's very similar to adrenaline. It's the go, go, go. Okay. So that's why the estrogen, you have that energy. Where the progesterone actually is about, it actually has a heat warming property on your body. So if you feel warmer at a certain time of your cycle, that's one of the reasons. But it's also the time just to calm, because you don't have that same sort of energy. An interesting thing that a lot of women who are going through who have depression or who have been labeled as depressive often aren't actually depressed. But what happens is they go through this wonderful, let's call it 1 to 2 weeks of estrogen, and they're feeling fantastic. But then progesterone comes down, and that's where you kind of really feel down. You might feel more angry, you might feel more sad, and that lasts a good 2 weeks. So then during those 2 weeks that they've forgotten about the 2 weeks prior where they actually felt good. And then they end up in the cycle where they remember those real times of the trying times. And then they get put onto antidepressants because they're labeled as depressed, but they're not. It's actually working with the cycles, acknowledging the cycles, and then looking at your lifestyle factors that are not going to cause such great differences between the two different cycles.
Oh, okay, interesting. So how what you do during these two phases is to a large degree also going to determine maybe the intensity of the menstrual bleeding part. Am I right? How heavy it will be, or whether it's going to be painful or not necessarily.
There are too many factors that affect your body when it comes to how much you bleed. Okay. Obviously, if you're not putting in the right foods, so if you're eating a diet that is high in processed food with very little nutritional value, that's going to affect your bleed. How you do push yourself, how much sleep are you getting? People kind of forget that they actually need to have a good 8 hours sleep a night. All of these factors, your food, your sleep, how active you are you sitting behind a computer all day? Your emotional state, do you let the negativity of the world get to you and you follow on through that energy? Or do you look at life with a positive attitude? All of this affects you. And I can't tell you how much that ability to love your body, that ability to have a positive mind frame affects your bleed.
Yeah.
And we are gifted with the ability to let go of what doesn't serve us anymore when we bleed. All that red blood reduces our blood pressure. That's why women generally don't have high blood pressure if they are not on hormonal contraception and if they've let their body flow naturally. That is why they often women say, well, they just had such a release of anger during their during their bleed. Because your body gets to bleed whatever doesn't serve you. And that's pretty cool. That's why it's a gift. Men don't get that. They hold it all in.
Yeah. Yeah, wow. So what would you say, what's your definition of a healthy cycle overall? What does it look like?
Okay. There are parameters that are normal. Okay. What I'm looking at is the three parameters are firstly your bleed. Okay. So what comes out of you. Second is your mucus phase, and I'll talk about that just now. And the third thing is how long your post-ovulatory phase is. So let's go back to point number one, your bleed. What kind of blood is it? Is it red? Is it flowing? Is there clots? Is it painful? Does it just feel like a little bit of discomfort because come on, the lining of your uterus is coming out of you? So there are those aspects. There's quite a few things that we look at when we look at your bleed. Okay. Your next thing is your mucus phase. Now, mucus is what comes out of your body, out of your vagina, out of your vulva, when you go to the toilet. And you'll notice it on toilet paper. I'm going to put it very bluntly. It has a kind of a color of snot. That's what it looks like.
Yes.
But it's that mucus, and mucus really tells us about what's happening in the ovaries, what's happening in the follicles, what's happening with the estrogen. It really tells us about the fertile phase of our cycle. And the next part is how long from ovulation to your next period. Okay, we ultimately want 12 days, nothing less than that, because that shows us that our estrogen progesterone ratio is equal. It tells us that there's enough time for implantation into an egg. There's quite a few things that tells us. So it's not just how many days is from the first day of your bleed to the next day, the day before your next cycle. There are those three parameters, and one thing can be slightly out, but everything else can be fine. It's okay. We look at the menstrual cycle as a whole, not just one aspect of it.
So there's a lot of detail to consider. But I'm sure that many ladies listening today might think, but how would you even know that? I don't think there's necessarily that many people out there who tracks their menstrual cycle. What are your thoughts on that?
So I must say, over the last 10 years, it has been wonderful to see the amount of women who are using apps. And I think that is just so wonderful that they're taking the initiative to think and be conscious. So I do love the fact that they're using apps. The reality is most of the apps actually go onto a statistical calculation, and that uses the fact that we all ovulate on day 14, which is not true. Stress, traveling, and illness all affect your ability to ovulate. Okay. So the reason women know this and they learn this is through the method of fertility awareness. It's when you are trained by a practitioner who will train you and teach you the theory, and then use your menstrual cycle to guide you over a period of anywhere from 3 to 6 months and help you learn what is mucus, what is not mucus, how to identify when you're fertile, when you're not. This method is a learning It's taking the time to learn about your body.
Mm.
And that's how you actually get to know so much. And I have to tell you, many years ago, when I went to a gynae, you know, we're all supposed to go to a gynae once a year. I was told that many, many years ago. And I took my charts and I sat there and I told the gynae about this and that. And I sat there and I told her everything. And she looks at me and says, "Why are you here?" And I said, "Well, I'm supposed to come to the gynae once a year, am I not?" She goes, "No, but no, you don't. Especially if you know so much about your cycle. There's no reason why I need to do any checkups."
Oh,
And I
wow.
think that's what's beautiful,
Mm.
is that you are your own practitioner and you know what your body's telling you.
Mm. So you're talking about a chart. You are registered as a Justisse Method practitioner, right? So, and that's all about charting. So can you just tell us a little bit more about what that is and how it works?
Okay, just like your period tracker or your app that you use, you will see that there's different variations. You can see it in a calendar form. You can see it in a kind of a little calendar, yeah, pretty much a calendar form. A chart in the Justisse method would show mucus, it would show temperature, and you would have to key in data daily. This data is based on what you can see, what you can feel, and what you observe. And that's what a chart is. A chart is when you put in data and then you get a picture. And it's better than going for blood tests. It's a picture of your internal workings of your body, which when women start the process and they grasp it really by the third or fourth month, they're going, "Wow, this is so incredible." And what makes it even more incredible is you have the power to make yourself more healthy. So if you're coming with cycle irregularities, let's call a severe menstrual pain, let's say depression, let's say thyroid, adrenal problems, or even hormone imbalances, you get to see this picture. And it's in front of you. And you then have the ability to make conscious decisions to improve your health and improve how you feel daily based on, okay, if I change this, let's call it, let's sleep more, let's eat healthy food, what is the repercussions on my chart? And you will see slowly over a period of 2-3 months how this chart changes and then how you feel. And I'll just use an example. Many years ago, I had a lady in my office and she had a very excessive bleed. It took her about 6 months to follow my advice, but when she did follow my advice, her amount she bled just in 1 month changed drastically. Because she actually listened to all the advice that I gave to her and she made those changes. So she could see that my suggestions wasn't just, well, try it, you're going to see a change in 6 months. For her, the change was quite instant because she made some big changes that she needed to make.
Wow. So it's almost like an objective assessment of how well the body is functioning, right?
That's exactly.
But also, I mean, it's this objective assessment, but also through making a few changes, it can absolutely impact the health of the bigger system, you know, the health of the rest of your body. It's not this isolated phenomenon, the menstrual cycle. It's so tightly connected with other systems in the body as well.
I think you've touched on something really, really profound there. And when you affect the reproductive system, you affect every other system in the body. And women don't realize that. So when they go onto a form of hormonal contraception, that contraception has to affect every other system, which we're often not told. We're often not told, oh, your migraines are coming because of the hormonal contraception. Your bloatedness is coming because of the hormonal contraception. Your pain in your legs, your hair falling out. These are just some of the common things that do happen because they think that it's just targeting the ability to have a baby or not. but they don't realize that every other system, every other hormone is affected.
Oh, wow, yes. But I think, so you've mentioned quite a bit on the impact of the contraceptive pill and how it's often often young girls are put on the pill for acne or something else, where, like you said, they're not necessarily told about the consequences or the repercussions. But I think one of the main reasons why women might take the contraceptive pill is because of convenience, right? But it seems like this convenience may come at a bit of a price, if I understand it correctly.
You put it beautifully, and it's a real hard discussion because we all have different backgrounds. We all come from different socioeconomic situations, and we also have different lifestyle factors. So firstly, there's not one answer that fits us all women, and that's what we have to respect. That I will not say that hormonal contraception is not is awful and none of us should be on it, because some of us don't actually have the choices that we would like to have in life. Yeah. And it is a better option than falling pregnant at 15 years old.
Yes.
So you've got to be very careful on how you approach this. But I think it's really an opportunity for discussion, an opportunity for education, an opportunity to weigh your risks, your pros and your cons. Any form, you got to say, why are you on hormonal contraception? What is the reason? Is it to prevent a pregnancy, or is it for acne? Because they're very different things. If it's because of acne, well, my first thing is, have you looked at your diet? Because the average child's diet is actually quite scary with the amount of sugar that they are eating and consuming. And I know this because I work with kids. I've been very involved with kids for many, many years. And some of their complete knowledge that, yes, sugar is bad, but I'm going to carry on eating it because it tastes nice. So when it comes to something like an acne problem, it comes down to more of a, let's call it a health or a physical, be it acne, be it severe menstrual pain, be it, trying to think of other reasons, moodiness. Some parents decide to put their children onto birth control pills because they can't tolerate the change in moods. If it's from that perspective, we really need to target why is the child experiencing those before we just give the solution of a birth control pill. And I think that's a really important thing from when we're looking at that kind of reason of a hormonal contraception for a young child. If it's because the child is sexually active, or the child may be sexually active, or the parents don't know how to make sure the child doesn't fall pregnant, there still needs to be education. And I've worked with very young girls who have made the choice to be sexually active. And we've really got to do the education. What are the risks? Do you want to fall pregnant? Why are you engaging in being sexually active at a young age? What is it you're getting from this relationship? Before we just medicate our young girls. And we do find ourselves in a time where discussion is more open than it was in our mothers and our grandmothers' time. And it's not an easy conversation to have with our daughters or our sons. But should we not be educating and giving them the power? So a good example is, if you have sex tonight at 15, you have 75% chance of falling pregnant. Are you getting 75% at school? And then they suddenly go, oh, 75% is quite hard to get at school. But I can get it in having a baby. Suddenly we change the perception. And there is time that you need to, or you want to put a child on, but they also need to know the risks. And if you go on at 15 and you stay on that pill for 10 years, what are the risks to you having babies when you're 25, 30, when you're older? Do you want to take that risk? Would you rather be on that birth control now and potentially not fall pregnant? do you potentially want to go on birth control and then have depression? Because we're seeing, you know, as I said, I work with a lot of 15-year-old girls. The increased rate of depression within our high school kids is huge. Is it because there's a lot of them on hormonal contraception? I don't have that answer. I have not done that research. But there are a lot of things that we've got to factor in when those decisions are made. And as I said at the beginning, not the right, every child may have a different answer.
Yeah. So what are some of the other side effects that are often seen with the use of birth control?
So the one that I use a lot is that it actually depletes all your minerals and your vitamins in your body. So you can eat a really balanced, a healthy diet, but that birth control pill is really leaching out all your vitamins, all your nutrients out of your body. We experience it in very different ways. Gaining weight is another one. Depression, hair falling out, sore legs. Some girls really battle with sore legs. Those are kind of the headaches and migraines are a big thing. A lot of women don't connect that fact that they getting headaches suddenly to hormonal contraception. Another big thing is the start of autoimmune disorders, thyroid problems. So those are your biggest things that where a lady, sometimes they do, but not often, they don't connect that the time that they started the pill was the time that other sicknesses actually started.
Interesting. Yeah. But what I also find quite interesting is, I mean, there's so much that has been put in place in terms of avoiding pregnancy. But if we look at the statistics, it seems like more and more people are actually struggling to fall pregnant lately. You know, lots of issues with infertility that we are seeing. So, you know, why do you think the infertility rates and also issues like, you know, the PCOS, PCOS, why is that increasing, do you think?
Okay, so we've got to remember hormonal contraception came into being around our mother's time. So my mother, and I'm 40, was one of the first women who had access to a guaranteed way of not falling pregnant. Okay, so the pill came into being 50 years ago. Okay. And with that, the pill then was a lot stronger than what it is today. So any girl who's probably around 40 or 30, any woman around 40, 30, is the first generation where the pill was actually accessible, with where we actually grew up with a pill. Okay. So how many of us were on the pill from a young age? Okay. The hormonal contraception, how long have you used it? And then I have to say, the way that our generation have been working, high-powered careers, the stress that comes with high-powered careers, the stress with not eating correctly, not sleeping correctly. And you always hear those stories of somebody couldn't fall pregnant, took 5 years, they decided to leave their job and they're pregnant in 2 months.
Yeah.
So the infertility comes not because of one thing, but it comes because of many, it's what we call breaking the camel's back. One aspect, no sleep won't kill you.
Yeah.
2 aspects, no sleep, no food won't kill you, or lack of nutritional. But it's when it starts piling up. And the infertility rate, we've also starting to have kids later. And the reality is we are not as fertile in our late 30s as we were in our 20s. It doesn't mean by any means that you can't have a baby. So don't let that whole thought process now that, oh, now I'm past 35, I'm old. But it's that greater need for loving your body that is required.
Yeah.
And the reality is that, are you exercising? Are you putting food that is good into your body? And that is the reason for the infertility, is because all of these factors compounded together result in not an ability to have a baby.
Yeah. And I mean, there's probably good reasoning. I mean, not always, but good reasoning around why you shouldn't be bringing a baby into this life currently. You know, if you're under stress or there's a lack of food, then it's probably not a good idea to reproduce. So it kind of makes sense. So let's just look for a moment or think a little bit about when someone does eventually get pregnant. What are some of the tips that you have? Maybe especially in the early phases. We know that many people, especially in the first trimester, struggle quite a bit with morning sickness. So what are your tips, especially in the first phases of pregnancy?
As a mom of 3, my tips to a new mom is sleep.
Oh, shame.
They never listen to me. And I say that because when you have a second child or a third child, you can never sleep like you did when you were pregnant with your first.
Yeah.
Because your body, and you've got to understand what your body's doing. You're carrying on with your normal life. You're maybe still doing exercise, which I hope. You are still going to work. You're still socializing. But inside your body, there is a little baby being formed with hands and eyes and toes. And to understand what your body is going through daily while you are pregnant, it is like running a half marathon every day of your pregnancy.
What?
So that's it's about 21K. And people forget that. So you've got to go and sleep. You are exhausted in that first 12 weeks. You kind of getting to halfway through the day going, I need to sleep. Respect that. Because I promise you, when you got a toddler, it's not so easy.
Yeah.
Food cravings really come when you are lacking something. So you got to wonder what you're lacking. But we all are allowed to have those food cravings as long as you're not abundantly going into the chocolate and abundantly going into the ice cream. So yeah, it's those are big things. Looking after your body. I don't believe that you must stop exercise at all. I think you must just carry on doing what you're doing. But again, when you've done a method such as fertility awareness and you've learned to listen to your body through pregnancy, you will learn when there's too much. I remember my first pregnancy, I was riding, and then I did a 60-kilometer, and I was like, I said to my husband, okay, that's it. Can't do that again. Because I was like, that was too much today. Now I know what I can carry on doing. And it's just listening to this body, because you're going to have to listen to this baby.
Yeah.
This baby talks to you. And I think it goes back down to fertility awareness. Did you let your body talk, and did you listen? When you have a newborn baby, that newborn baby is constantly talking to you. At first, when the baby comes out, you've got to figure out each other's language. But, my 2 kids were much older when I had my third. And I would say to them, oh, the baby's saying this to me. Oh, the baby's saying this to me. And they would often go, Mommy, what's baby saying? And I would tell them.
Yeah.
And they would say to me, how do you know? I said, because baby was inside of me. And I've had to listen. And once you learn that, motherhood is as easy as it's going to be. And it is that connection that started off with connecting to your body, because your baby is just an addition. It's 50% of you. And yeah, that's where that first trimester is learning to hear what the baby's saying to you.
Yeah, so it's a combination of listening to the baby once it's born as well, but throughout all of this, listening to your own body, knowing when to stop, knowing when to do whatever it is that you need in that day. So I just want to circle back to.
I just want to add something there. I always say that a woman who's given birth understands what it's like to give birth. A man, I don't care if he's a gynae, We'll never know the pain. We'll never know the true experience of what giving birth is.
Yeah.
And I really believe that when you are pregnant, you need to find your team of women who are going to guide you, because you don't know this. As a first-time mom, it is a learning curve. You can read as many books as you want. The doctors don't have the time to answer these questions. It is surrounding yourself with a team of women who's going to guide you. And let's look back at our grandparents. That's what we did. The grand passed the information to the mother to pass the information to the daughter. And we have moved away from that. We have, and goes back to our conversations of hormonal contraception. It's not the doctor's place to talk to a daughter about hormonal contraception and sex. It comes down to that generation of talking to our daughters and passing the correct information on.
Yeah, I like that. Having the right support during all of this, I think also is absolutely crucial. So I just want to think about a little bit more about, so you mentioned how you actually recommend that you keep on moving, right? So yes, listening to your body, but are there any of these old wives' tales that are actually true when it comes to exercise during pregnancy? Are there certain movements, certain types of things that we shouldn't be doing? Is there a certain time that you should stop? Maybe you can debunk some of those myths for us.
So I always say carry on doing what you were doing before. Okay. Because your body knows it. So I'm a cyclist, and I have seen all my age women go on, have babies, we all come back to racing. Those women, one of the top racers in South Africa, she was racing 94.7, she was about 6 months pregnant, because that's what her body knew.
Yeah.
But don't go and start cycling because you're pregnant.
Yeah.
Okay, so that's rule number one. Don't go and start something that you haven't done before. From a movement perspective, you can carry on doing everything. Swimming is fantastic. Walking is fantastic. If you were doing some sort of Pilates or yoga, fantastic, as long as your instructors know that you are pregnant, because there are movements that you must not do when you are pregnant. And I think that is really, really important, to work with a educated pregnancy instructor if you're going to do exercise. But otherwise, your normal cardio, walking, some women run right through their pregnancies. Again, when it doesn't feel comfortable anymore, stop. So yeah, that's a big thing, is just listen to what your body's telling you.
So, I mean, we've kind of walked through all the phases, and I think the last one that I want to touch on before we finish off is just, the act of giving birth. I think, like you said, it's extremely painful, and there's not, men doesn't necessarily understand the intensity of all of it. Anything that you want to perhaps share with our listeners as, another woman, and your experience around that?
The first thing I want to say is don't be scared. Women have given birth for hundreds of thousands of years. And it's only in the last 30, 40 years that there has become this fear that we cannot do it. And we are all given the ability to have a natural birth, and the birth that we are supposed to. Now, remember, natural birth is actually there that we can get up after birth and carry on with life, because we have to. We've got a newborn baby. Okay. But unfortunately, it really comes with searching with the right team these days. I was incredibly lucky, but I researched. This isn't a case, women are happy to go into 25 different shops to find the right pair of shoes. Yeah. But are they happy to go through 25 gynaes or 25 midwives to find the right midwife that they connect with? And it's so important to find that person who is going to take you through one of the most important transitions of your life. The trauma seen in mothers because of their birthing experience is huge. And, you know, one of the worst phrases I hear is the baby safe? Well, actually, the mom has to be healthy. Postpartum depression doesn't just come up because this is what happens because you know, it's a thing. It comes because how was the mother treated in her pregnancy? How was the mother treated during her birth? Birth happens in a certain time frame, but we really have to respect that midwives are very trained in delivering healthy births. And we are fighting a world of medical model where we are supposed to give birth in 6 hours and it has to be done lying down. And when we are faced with that sort of birth model, it's not conducive to a healthy birth, a happy mom. And a happy mom and results in a mother who can look after her baby. And as a new mom, you have to have your team. You have to have your person who's going to teach you how to breastfeed. I've been talking with a lady, and I'm very careful on where I add my knowledge. But a woman has got a 3-month-old baby that I've been talking to, and she's in constant pain breastfeeding. And I'm going, you shouldn't be in pain for 3 months breastfeeding. Breastfeeding, if it's painful, is something's wrong. Baby needs to go for a chiro, cranial sacral therapy. That journey of that baby down the birthing canal is a horrendous journey. And we have these incredible specialists who can just manipulate the baby's body, and then we can breastfeed and we're all happy. So understand that there is a team, and you have to look out for your team. And in all 3 of my births, I've had the most phenomenal team of women who've actually become my good friends now. These women have taught me what I know today. And if it wasn't for them, I would never have been the mom and enjoyed the 10 years of having babies. And I look at newborn babies and I just go and take them from mom's hands because they are my favorite age, because they are it's such a lovely phase if you've had the right guidance.
And it seems like this journey starts actually from a very young age. You know, it's not just about suddenly becoming empowered when you're pregnant. I mean, starting to listen to your body from a young age could be extremely empowering. And I think in the end, being an empowered mom versus just a mom could make a huge difference.
Completely.
Yeah.
And one thing that I really get upset about is when a busy mom who's working, she falls pregnant, and then I'll ask her questions like, have you researched this? Have you researched that? Have you researched this? And they go, no, I don't have time. And if you don't have time to research, then you're going to make mistakes. We live in such a digital era where it's so easy, but you've also got to research all the options because there's different sides to the spectrum. There is the medical, there is the more alternative, and you've got to find what sits with you. There is no right and there is no wrong, but you're going to live the consequence of those decisions that you make. And this is your biggest research study that you will ever have. And it is an ongoing 18, 25, never-ending journey.
Oh, wow. So it's so insightful. Thank you so much. And I think many people out there listening is gonna try to find you. So how can they find you, and how if they do need your support?
So I don't have a website anymore. I work with women who want to learn.
Yes.
I used to have this as my main career and my main job. And I eventually just took it all down and said, if you want to find me, I will be willing to help you and take you on this journey. So I have an email address, ourperfectbodies@gmail.com. I have WhatsApp or a cell phone. You can get me on cell phone. But apart from that, those are the 2 ways that I connect. I don't do any social media. I don't do any of that because I literally only want to work with people who are open and ready to learn and want to learn about their bodies.
Oh, I absolutely understand that. Yeah. Okay, so any last thoughts before we end off that you perhaps want to leave our listeners with? Maybe as a bit of a summary or anything else that you want to share.
Your body is beautiful. Just learn to listen to it. And once you learn to listen to it, the world is your oyster.
Fantastic. Thank you, Claudia. Lovely having you on the show, and all the best.
Thank you so much. And
everything.
Zena, so lovely to connect with you again.
Fantastic. Thank you. If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.